Muhammad Rozain from Group 3. I'm here today representing my other team members of Group 3 to present on how Ministry of Health managed COVID-19 pandemic in Malaysia. COVID-19. What is COVID-19? COVID-19 disease is a virus-borne infection caused by the SARS-CoV-2 viral. The symptom of coronavirus, you get cough, fever, headache, tired, chills, sweats, aches, and difficulty of breathing. Right? Where does it come from? COVID-19 first discovered in December 2019 in Wuhan, China. It is very contagious and quickly spread around the world. As on 25th of January 2020, the first case of COVID-19 was detected in Malaysia, and it traced back to 3 Chinese nationals who previously had close contact with an infected person in Singapore. They had traveled to Malaysia via Singapore on the 24th of January 2020. COVID-19, how does it spread? When an infected person coughs, sneezes, speaks, sings, or breathes, the virus can spread in microscopic liquids particles from their mouth or nose. These particles range is in size from big respiratory droplets to tiny aerosols. People can become infected by breathing in the virus if they are in close proximity to someone infected with COVID-19, or by touching contaminated surface and then touching their eye, nose, or mouth. The virus spread inside indoors and crowded places. Dangerous of COVID-19, you not only get severe damage to the lung, which may or not be directly attributable to the virus, but also the cytokine storm can contribute to clot formation, kidney damage, and heart damage. This is what causing some people to become severely ill or die. Right? Impact of economy of COVID-19. Right, the economic and social disruption caused by the pandemic is devastating. Millions of enterprises face an existential threat. The pandemic has decimated jobs and placed millions of livelihoods at risk. Yes. Ministry of Health managed COVID-19. The MOH has established a National Crisis Center to coordinate the response to the pandemic. The MOH has implemented a number of measures to control the spread of COVID-19 in the community, including conducting contact tracing, quarantining close contacts of confirmed cases, implementing quarantine measures for individuals who have traveled from countries with high transmission rates, and the MOH also implemented a number of measures to protect healthcare workers and ensure that they have resources they need to protect patients with COVID-19. Definition of planning. The planning process involves defining goals and objectives, as well as determining the steps and resources necessary to achieve those goals and objectives. Management's primary purpose is to assist organizations in achieving their goals productively and cost effectively. This is an essential management function. And type of planning. The formulation of tactics involve defining organization long-term goals and objectives and developing a strategy to accomplish those goals and objectives. On more tactical level, planning entails the creation of specific plans that are intended to aid in achieving the strategic plan, long-term goals and objectives. An example of operational planning is the creation of plans for the day-to-day operation of an organization. developing plans to respond to unanticipated event or disruptions is a crucial component of contingency planning. Preventive steps that Ministry of Health applied. Ministry of Health Malaysia used lockdown with different restrictions to stop the COVID-19 outbreak. Government used a targeted screenings approach to find and screen COVID-19 cases, set up institutionalized isolation and quarantine system to house all confirmed cases, person under investigations, and close contact at government-run facilities, and give citizen and non-citizen the same treatment. MOH strategies not only followed all of WHO's PRP's suggestions, but also stopped the outbreak and let social and economic activities happen simultaneously. Government did mass screening of high-risk group at AMCO location to find suspected cases. Managing the issue organizing. Definition of organizing: the working relationships, vertical and horizontal links between individual and groups that exist within an organization affect how its activities are conducted and coordinated. Effective organization relies on mastering a few key concepts such as work specialization, chain of command, authority and delegation, span of control, formalization and centralization and decentralization. Importance of organization: efficient management, benefit of specialization, create a sense of transparency. Work specialization: to isolate the patient that have been infected with COVID-19 disease, government have selected a few referral hospital for handling suspected case and authentic COVID-19. It can ensure and increase the work output of the staff in that certain hospital. It help the staff to focus on the COVID-19 patient treatment. Hospitals and healthcare facilities offer rehabilitation for long COVID-19 syndrome in every state in the country. Also help to control the COVID-19. This is a chart of span of control and chain of command. Managing the issue: decision making. Three types of decision making by MOH in managing COVID-19: enhance movement control order, social distancing, and introduce guidelines for workplaces. Introduce guidelines for workplaces. Managing the issue: controlling. Definition of controlling: all organizations strive to achieve some goals through their organization activities. It is important to check whether the organization is performing its activities according to the preset goals. Management control functions help the organization ensure this. Management, therefore, means comparing the actual performance of the organization to plan performance and taking corrective action when the actual performance does not match the planned performance. Management cannot prevent deviations between actual and planned performance. However, deviations can be minimized by taking corrective actions and decisions that can reduce recurrence. Importance of controlling within the context of finding solution for the COVID-19 problem. Achievement of organization goal, evaluate standard accuracy, and use resource efficiently. Implementation: public health measures such as physical separation, mask use, and hand hygiene. Developing and implementing contact tracing system. MySejahtera is an application developed by the Malaysian government to aid in the management of COVID-19 outbreak in the country. It enables users to do health assessment on themselves and their family. Users can also track their health status throughout the COVID-19 outbreak. MySejahtera enables Ministry of Health to monitor users' health conditions and take rapid action in giving the necessary treatment. It also enhancing surveillance and testing capacity to detect and respond to new cases as MySejahtera application is developed by to assist the government in managing and mitigating the COVID-19 outbreak, help users in monitoring their health throughout the COVID-19 outbreak, and assist users in getting treatment if they are infected with COVID-19. In Malaysia, the pandemic is controlled by the government under Ministry of Health. The Ministry of Health conducts all research and examination about the COVID-19 to find ways of healing and prevent the disease. The Ministry of Health also advised Malaysian government to announce a lockdown to prevent COVID-19 from spread among the community. The government also developing and implementing contact tracing system to identify and isolate cases quickly, such as MySejahtera. MySejahtera was an application full with information about the COVID-19 and info control by the Ministry of Health. MySejahtera is an application used for Malaysians to get information, and it is tool for vaccination appointments for all citizens in general. The Ministry of Health Malaysia still advising Malaysia to take care of their health and keep themselves clean to avoid COVID-19. That's it all. Thank you.